Hi there. Oh my God. Batu. Hi there. Winna. Bona wiki. Hi there. Batu. Tobela. Dumelang. Sanbonani. Dimachurun. Abushed. Good morning. And really, Livicha Lanka ki salesman, aka Wamotokwa. And really, Akina Manchanga Shumishang, who wants how happy, proud. And, Batung, please, it's not a sign of disrespect. Find it in your heart, please. Mr. DJ, can you take the sound down? You know, really, and to the dignitaries, Batung, I'm happy. I'm proud. Thank you. Yeah, kya tseba likhumane program barothomaka and ane bjalo lebella re thomile ka re swareleng bathong. It's not a sign of disrespect. We plan and the Almighty God plan. And God's plan is the master plan. When kitimeche when ritaso and again this is getting out of hand. Vuchisha kabona sesio mong ka bontshonyana ka modaoda ka re thobela re merene ke re ba ba na le nnete ke re please man Anlava clinic ile kwe wena ka confidence ya Setsonga wa bona ndlela le wena wa famba ne uko o fambe uko o fambe uko o ta ikuma kwala ke re yo bana ka lebella ka krea o mong plus o ka ro tsasitse Vaseline idile dasto ka ro ber di pentos tse beige ka re thobela re ka movango ashu which is and I get to begin ka basadi ba Limpopo a bolela net o se ka misha tho the renda nendo khera ni koto that clinic only 2 ways do the job ani I want in delati ni do chimbira na gonya na ya fase na gonya ni do iwan karno erigenya ke mo pedi wesh kar sesiwe ke late tse bathong clinic nka ikhumana kae ara buto lebelelo ka se lebelelo ka se bone wa bona tsele o sepele ka yona straight molotho mo kwa ka ro fela pelo o rthe but please find it in your heart or tshwarela bathong and kajeno is the launch of the AYFS. Biale, for now, ladies and gentlemen, I'm excited to call onto the stage the hot chicks. Woo! Ladies and gentlemen, the hot chicks. Makaunyane, the hot chicks.
Abash. Hot Chicks Entertainment abafana bamijeka abafana ba style abashi
sisebenza kanzima
All right. Sister Bettina. All right. Hit it in time. Oh shit. You better see. Show me too. Oh shit. Show me too. Oh shit. Show me too. Oh shit. Show me too. Oh spare part of it.
Hot Chicks abafana bamijeka bathe
This is Zing Master.
Yeah, bro. Where you going? Where you going?
DJ wamizwa lafu phela ngifuna ukujavisa abantu ngifuna wiggle
Chixifitas como güey. Vamos chixifitas como güey. Ubab. Todo buena ngabubisa ngabushaya hamba.
ya difitlile ntwana tsenyane ntwana tsa kuvuki ntwana tsa uhasha kota ena kotana hasha ngota bafana
ya difitlile ntwana tsenyane ntwana tsa kuvuki ntwana tsa uhasha kota ena kotana hasha ngota bafana
Abash.
You're my sweetie. I'll give you pleasure.
ya ngimfaqile niyenzani
What's some late music?
Abash.
masala wena
So what we're talking about today, few things. We're talking about why it's important for young people to have access to health services, but not just any health services. It's always got to be quality health services. So as Love Life some years ago, and I think we could be going back a good 14 years ago, part of the feedback that we gave to the National Department of Health was that young people hate going to the public healthcare facilities. And why was that? Well, they felt that the resourcing wasn't so great, and the treatment that they got, that when they got there, was just not up to standard. So as a result, they preferred to stay at home and only sought medical help when it was too late to do so. So what did we do with our knowledge as young people? We got together with the Department of Health, and together we conceptualized and designed what we call the adolescent and youth-friendly services, meaning that we were part of ensuring that health practitioners in public health places knew how to work with young people. So instead of being like a matron or a school teacher or your mom and pointing fingers when young people went to seek help, especially help that was related to their sexual and reproductive health, they got a warm welcome, they were affirmed, they were made to feel that they're taking responsibility for their decisions, and in that way, they were taking control of their future. So it is important that we continue to enable young people to access good quality healthcare. And more so now, as we see a growing population of young people coming into cities and living in peri-urban communities. The combination of sexual and transmitted infections, the combination of substance abuse, the combination of HIV, AIDS, and now we've just got another layer called COVID that's leading to mental health issues. Those really require that young people are able to access a clinic easily at a time that works for them, and they are met by a professional person who understands and remembers that they were once a young person, because a lot of times we forget where we come from. So if we remember we were once a young person and we give the young people the services that we would have wanted to get, then I think we'll be taking great strides in the right direction.
We have public health facilities as usually the point of contact, or sometimes the first point of entry when such has happened, especially if it can be trauma and in a facility that needs to be sorted as well. It can be sexual harassment or sexual assault, let me say, where that as well, that's where we now end up having to look at issues of possible unintended pregnancy, possible acquisition of HIV, as well as psychosocial support, other STIs. So we need to screen. We need to ensure that we test for HIV. It's very important that clients are aware that in order for us to prevent unintended acquisition of HIV through sexual assault and to access PEP, which is post-exposure prophylaxis, one needs to have a test. The reason for an HIV test is to establish HIV infection at that time, because if one is already HIV positive, then they need to go on treatment for life. However, if they're HIV negative, the whole idea of PrEP is to prevent possible acquisition. It's a short-term emergency course that's just for 1 month, and it needs to be taken within 72 hours. It's very important that the communities are aware of that it needs to be taken within 72 hours, which is 3 days, just in simple terms. The earlier, the better, but at the latest, to ensure that the efficacy of the treatment is at its highest. And then again, we have what we call Thuthuzela centers. These are centers that support psychosocially the client that has undergone this type of violence.
Integrating healthcare services is a very important and a fundamental point in the human rights program to accommodate largely young people. We know the needs of young people is largely sexual and reproductive health and their rights. It's a global phenomenon that must accommodate all young people. The provision of sexual and reproductive health services to adolescents and young people, in particular young women and girls, will contribute towards the prevention of HIV, towards the prevention of sexually transmitted infections, will also contribute to the attainment of the 1990 strategy. And the integration will, among other things, strengthen the campaign that we call Check-in Bill. If family planning programs is something extremely sensitive for young people, they must find someone who's a familiar face, someone who's going to be trusted, someone who can accommodate their fears. And when they come to facilities asking for HIV testing, asking for sexually transmitted infection screening, asking for pregnancy screening and testing, it must be someone they would want to talk to who's very familiar and who can be trusted. The health information that they seek towards their health education, health promotion is extremely fundamental. We were very excited to see a particular province called KwaZulu-Natal starting something that is called youth user-friendly services. We now call these the youth zones, where they could be able to locate a clinic nearby to where they live that is very convenient to their walking distance, or then they can find it easy and find a nurse who's well trained to look and support young people. Why is this important for young people? It must be a facility that they can access with all the convenience to themselves. Young people, you will not know, are very busy. They are busy in their social life. Some of them are actually busy with schooling. So it mustn't be something that they have a long way to go to when they want to find it. It must be also, we need to do it because the majority of our citizens in any particular world are young people, and they still have to have a positive future about their lives. Therefore, when we screen them, we assist them to access information that has to do with their early processes of exposing them to early diseases. Screening for HIV, STI is very important. So this initiative that was started in KZN of youth zones is like a safe space for a young person to access a health service with a friendly person. It was once termed a happy hour. We know young people finish school around 3 o'clock and therefore walk home. If then our health clinics can be available around 3 o'clock to accommodate them for like social clubs, they are together sharing their problems, talking to a very friendliness in a very relaxed atmosphere without any fear that they will be reported at home. They could then share with us even challenges that they could even not tell their own parents. In that way, you become a trusted healthcare worker in that environment. We need to promote this because we are actually focusing on this young person. We are focusing on this group of young people to be able to do well for themselves, take responsibility, take charge of their lives. The young people will then form clubs, social clubs, networking, even be able to advise each other through media, and that is what we need. They will debate health issues amongst themselves, having been given health information, health education in the facility. So we would really want to encourage this, what we sometimes call adolescent youth user-friendly services, where young people can be together without a fear of getting an adult who is a stranger to themselves, talking to themselves, asking questions from one very professionally nurse who is able to handle them professionally, who has the knowledge, and that is actually what we are advocating for. Promote health user-friendly services. Phambili no check impilo wabantu abasha.
Good afternoon, colleagues from the Love Life and also young people out there who have decided to join this quite important event. Let me start by appreciating you as Love Life for your generous invitation to me. As the Department of Health, we have now established those structures that used to be there. In my province, I can speak for them that we took that advantage of the budget by the grant which was allocated to establish and revamp our Thuthuzela Center, wherein if a woman or a girl child, we started with all the hospitals that are within the hotspot area. Mokopane Hospital in Mahwelereng, for instance, Kapane Hospitals is somewhere in Mopani district. We and many others. Those Thuthuzela Center, that's where if you have been sexually assaulted, you will arrive there. You are going to be welcomed by a forensic nurse who has done a forensic, and she will be able to take you through the entire process. If the doctor will also be there to collect all the evidence that is required. You will also get, because there are police there who are working with us. When you arrive there, then the forensic nurse, one of the responsibility is to call the police to bring the rape kit and the J88 form, which will then be filled in by the doctor, and the kit will also, they will collect those specimen and be able to do that. Now, I can tell you that system, we find it working, because we also have got the psychologist who will be called so that they can deal with that. Thuthuzela Center help us to make sure that you don't go and wait. You are not competing with the drunken driving road accidents. You are there to be able to deal with. That's a show of commitment from the healthcare workers, from the Department of Health, how we are saying our contribution towards fighting gender-based violence will make sure that all the perpetrators get that particular treatment, where they will be able to be provided with that particular care. So don't be afraid to say, when you have been raped, you visit your nearest facility. If they don't have J88, if they are not, they will call the police will come to the hospital and they will attend to you. Then the second one is this one of you coming to us because as we have been violated, whether it's sexually or it's physically, you have been damaged and you have gone through trauma. You need physical treatment where we must be able to provide you. If you have been assaulted, we must suture you. We must suture you. We must give you medication. If it's sexual assault, it's a serious issue because we need to give you post-exposure prophylaxis to prevent yourself from getting infected with deadly virus like HIV and AIDS. We need to make sure that we give you also the contraceptive, the emergency contraceptive pill, so that you do not fall pregnant with an unwanted pregnancy of a child that will be born because you have been raped. But we're also saying to those who even if for whatever reason they found that they are pregnant and they don't want that pregnancy, you have a right to approach us. We've got all facilities that have got safe termination pregnancy. Don't go to Corner Street, Hill of Street, and see there is Dr. Chimurenga there who's just going to put you and give you all this concoction. You will come to a facility with that street abortion just for you. If you are lucky, you might develop septic abortion. We'll have to do a hysterectomy. You'll never have a child again. If you are not lucky, we will be forced to do, you die on arrival. I have witnessed a number of girl children. That's why, if you remember when I had these active campaigns on safe termination, is because I've dealt with many maternal death of girl children as young as 16, 17, 18, as a result of unsafe termination of pregnancy. And we're still dealing with them even today. So we want to indicate you to say, government has got safe termination facility, which are free of charge, which we do not charge you. And also, we also emphasize to all those nurses who are conducting that we, on a regular basis, take them for debriefing so that they continue to work with that particular patients because they're dealing with a stressful. So we will give you those contraceptive emergency pill. We would have treated you for any STI. We'll give you antibiotics to treat you for any STI. We would have done it, and we'll advise you to stay away at least from having unprotected sex with your spouse up until such time, so that you continue with your proposed exposure prophylaxis.
Nibonani, igama lami nguNonkululeko Cibekhulu.
Lethiwe ngaKhumalo.
Thembisa ngakwaNgcobo.
Ngunelisiwe Wandlovu.
Nosize Ngoni, eGrambeka.
Well, thank you very much for the invitation. I'm very pleased to be part of this celebration as a government as a whole, but also from the Department of Health. We are aware that the society is moving, and especially our young people using a lot of modern technology. So we also don't want to be left behind. We want to make sure that in making available a lot of the information which I've mentioned, which gives empowerment to young people, especially young women, to be able, to make sure that they keep healthy, that they can protect themselves, that they can plan their lives, make sure that especially their sexual and reproductive life is properly planned. And so to provide that information, amongst others, we're trying our best to make sure that the services we provide are youth-friendly. So the youth zones are meant to make sure that at our health services, we can you can structure them in such a way that they are user-friendly for young people. So that's why we are encouraging our health facilities to provide very specific services which are properly tailor-made for young people in terms of time, away from all the older people who are coming there to collect their sugar, diabetes tablets and blood pressure and all that. Make sure that the time and the kind of zones at which the services are provided are user-friendly, but also using technology. And that's why mobile services and also technology like BeWise, using live websites, is to make sure that young people can interact with these services. And I must also just add that if you look at BeWise as a form of portal for information, I can also assure the young people that they don't have to worry too much about data, because this service can be accessed on their mobile phones. They can access them on the BY's website, and this is provided free of charge through our relationship with the various service providers such as Vodacom, MTN, and also Cell C. So this is good news, and we want to encourage our young people to access these services.
Ke Masphuma a buang, re tle go direlanyana a dialogue because MC wa rena o fetsa go bua gore it takes a community to raise a child. And at the same time, go na le gore bana ga ba le ko gae or ga ba le in the community ba kgone go bua le batswadi ba bona. But is it easy for the youth to speak to their parents about sexual health? So most stage mo ke na le batjha, ke na le batswadi, so they're going to dialogue to respond to whether it's easy or not gore ba kgone go bua ka di sexual issues le batswadi. So I'm going to give first to the youth. Is it easy now? If it's easy, it's yes. And then the reasons why they say it's easy. And then if it's no, it's no. And the reasons why bare go thata.
Dumelang. Dumelang. Nna ke nna Palesa. And then ha re bolela ka topic e how easy o bolela le batswadi, because batswadi sometimes a ba tlhalohanye. O tlhoka go bolela le motho a lekanang le wena gore like a o tlhalohanye le utlwane pila, because batswadi sometimes ba omanyana ba phela ba le harsh, a ba tlhalohanye. So like for nna how easy.
We had her are batswadi le harsh. Ga le tlhaologanye. Ha re utlwe mo.
Dumela. Lebitso ke Teboho, as I said. Na for nna who easy ho bolela le bontate mostly, because ho bolela le ntate o kono advise hore ho le motho you must use a condom, and also ho yetitse di mistake o kono bolela le na o mmotsa hore papa ke yetitse di mistake. And then yeah, it's easy hore o bolele le bontate, because I might say for nna mme yes, mme for nna ha tlhalohanye o ba harsh.
Mme o hashi mara ntate wa tlhaologanya wa bua ka condom ntate.
Dumela. Nna ke nna Kutlwana, and for nna ke bona ho le easy because ba bangwe ba open le batswadi ba bona. And ho sharp hore o bolele le batswadi ba hao, because ba ka o advise ka dilo tse dintsi. Ba o tlhalosetse hore ha o le ngwanyana tshwantse o prevente hore o sa tle o kgone ho ima.
Yena a re go easy because batswadi ba go fa di advices tsa gore o ireng, especially ga o le ngwanyana. E re ke utlwe ka saeteng la batswadi gore is it easy or not?
Dumelang batswadi. ke Monica Baloine. Nkare nna kare, it is easy because gona le bana ba gone benong ba kwatetseng batswadi. For now, mo nakong ya gone benong it is easy because gona le bana ba ileng hore bana le di anger ba kwatetse batswadi ka lebaka la hore ha nka ba fa tšhono ya hore ba bolele le bona. So for now, ntho engwe le engwe is on the table. Re lokela hore re tlhalosetse batswadi ntho engwe le engwe e re sokodisang mo mebeleng ya rona. Ke a leboha.
Dumelang batswadi. Okay, Colin Mabaso. Ke nahana hore ho botlhokwa hore o be ha o le ngwana ho be le motswadi, if can't be your father, ebe mama o leng open le yena o khonang ho boledisana le yena ka di problems tse o kopanang le tsona le di challenges tse o kopanang le tsona, because go bofelong ba letsatsi hona le malwetse a ileng hore ha ka o fitlela o sa le motjha, there's no turning back, ha o sena reverse. So you have to be friendly with parents hore o khona ba open o bolele se seng le se seng se o bonang hore se botlhokwa mo wena. Ke a leboha.
Okay, re kre ntate wa rona wa mafelelo.
Dumelang batswadi. Ke Mzamani Chauke. Batswadi ho easy ho bolela le bana ka issues tsa sex. And then ke nahana hore batswadi ba know as madom like ba ba hoditseng rena. Like pele it was a taboo hore o bolele le motswadi ka sex, but now le maemo a change malwetse a teng. A re ben ditsala le bana ba rena ba gaetso. Re bolele le bona, feeling free bolela le bana, because he o sa bolele le ngwana hao o kry influence ko strateng a ba kry le di practical. Ke a leboha.
Ke a leboha haholo. On the side of the parents, it's very, very important gore re be le di dialogue tse tshwanang le tse, gore when we are with them re kgone go gather gore re approach yang di topics tse yalo le bona. They were saying we are harsh. Mara nne ke re rena re le batswadi go thoma mo go rena. Go na le mafoko a reng listen to anything your children want to tell you. If you don't listen to the small stuff now, they won't tell you the big stuff later. So it's very important. If you want to know re le batswadi, re sa itse gore ngwanaka what color, what is her or his favorite color, re latlhegile. So but then le rena ga re le bana, I will encourage you to say sometimes ge le batswadi ba ba sa itse gore ke nako ya gore ba bue le lona ka di issues tse byalo. So if lena le fila gore le ready to talk about these things, approach them in a manner that won't be disrespectful. Then they'll sit you down, ba kgone go bua le nna ka di issues tsa sexual health. Because at the end of the day, le ya go di pie, lena ha le le bana, le tseba just a bit about sex. Mara ge ba le bana, they are experienced about sex. So, ha re lo bua, what you have to do, social worker na re botsa ka di decisions that we have to take. But then I would say you must take informed decisions. When you take a decision, first get research about the decision that you want to take. So, ha re le bana, we need each other. Batsadi le batjha, gore re kgone go fitlhelela a goal e rileng. Gore re skebe le bana ka nako e sa tshwanelang, akere gore re skebe ra ba le malwetse ka nako e sa tshwanelang, but then re kgone go bua as parents. So I would encourage both parents and kids or youth gore ga re be le a platform of this kind, gore re kgone go bua le bona. Yes, in the facilities re na le di platforms tsa di AYFS, but then ga re ira di events, let's call our parents, let's call the communities, we go to community halls, we sit down with them, parents this side, youth this side, we discuss these kind of issues, and then we'll have to re tlo ba re dira a decision or ra ba le an outcome e tshwanang. So ke dialogue ne re bua ka yona nka se re bontsi ba bana ba re it's not easy, batsadi bona ba re it's easy. But then batsadi ba re it's easy because I think it's because bona ba bagolo mo go bana ba bona go le easy, but go ya ka bana it's not that easy. Mara gore go be easy, it's when we promote these little talks. So thoma ka go bua fela gore hey when wa ka tsheko o ka re o byambya. Not wait for the time where now ke thoma mona gore ha sa bua ka 5 o bua ka 8. So those kind of issues rena re batsadi we have to observe them. So I think with the little info that we had, or with the little dialogue that we had, we can conclude that we need to speak le batjha ba rona in terms of this or in terms of sexual health. It's not only going to be the clinic that is going to cater for sexual health talks, because le bona bana le mebereko e meng. But rena as parents in the communities, we need to also have platforms where we talk about sexual health. Gore bana ba rena ba be le sexual health e leng right. Ke a leboga batsadi.
Nibonani igama lami nguNkululeko Cibekhulu.
Lethiwe ngakhumalo.
Thembisa ngakwaNgcobo.
Nginelisiwe Wandlovu.
Nosize Ngoni, eGrampekasa Love Life ngisesithebe clinic. Esithebe clinic clinic youth friendly kakhulu, iyayamkela youth noma bengasikhatsini and ama services akhona maningi. Kwazise mafuna ukuhlela ufuna ukuchecka o-HIV o STIs nje yonke leyo nto leyo i-clinic ikhona i-available and iyawa offerisha lawo ma services.
Namhlanje ngizonibalulela ama service aprovidwa ngaphansi kwe Claremont Clinic. Claremont Clinic si provider i-youth zone ebizwa nge-happy hour lapho sisebenzisa khona uLesithathu noLesihlanu past 2 kuya ku3 lapho khona osebenzisana khona nami as i-groundbreaker uphinde usebenze no nurse osebenzisana ne-youth oprovide nama contraceptives aphinde andalulele nje if uneyinkinga ekhaya obhekana nazo o gender based violence aphinda kwazi ukuthi akusize lapho.
As we are wrapping up youth month, we have seen ukuthi gender based violence ibe nama cases amaningi. So thina esiyenza ku clinic we offer services to such people who are victims of gender based violence, especially those who are raped. When it comes to the clinic, Tina, as a Love Life groundbreaker, we refer you to a social worker, even call on your behalf to come and help you. And then the clinic they give you a PEP, which is an emergency pill, which will help you if you to HIV positive. A PEP will help you with HIV ingabuyeli.
Ngivakashela izikole ngiyofundisa about gender ukuba bayithibe futhi laba abasebahlulekile uyithiba benze ucansi oluphephile. We mostly have ama youth festival just ukuthi bakhiphe bebusy bengalokhu bacabanga izinto wrong since basayi youth, bese ngisiza nalezi ingane ezihlukumezekile kungaba semakhaya kungaba kuma partners abo abanye thola ukuthi usehlukumezekile wangena kuma drugs akasazi ukuthi uzophuma kanjani. Ngenelela lapho ke mina ukuthi ngixoxa naye mase ngimrefer kuma social workers.
Siba ne youth zone lapho khona ehlangana sonke njengentsha ukuze sikwazi ukukhuluma ngala topics. Mhlawumbe unembuzo ungakwazi ukuthi uphamise umbuzo wakho ngikwazi ukuthi nguphendule lo mbuzo wakho. Mengabe angazi mina angwazi impendulo yombuzo wakho ngiyakwazi ukuthi ngidlulisele komunye ongakwazi ukuthi akusize.
Ama services offer imadiba sino ama contraceptives sinayo i-youth zone kubhaliwe futhi nama human rights abantu kufanele bewenze siyapromote AIFS kune suggestion box again siya distribute ama condom siyayenza i-condom demonstration bese again siyakwazi ukuthi sibanikeze information ku-help desk yethu ikhona mayelana nako konke okuyisifo, especially izifo esuke zikhona OTB, HIV, STI, coronavirus, including gender-based violence. Bangabe sifika sitholana necase, into esiyenzayo ukuthi siyafona, sinalo ucingo lala ekhaya lokufona, sifonela amaphoyisa uma kuthi kunenkinga kufanele sifonele amaphoyisa.
Nabahlukumezekile bayazi bafike beyicela iGB bese ngikhona ukuthi ngindlulisele ngikhulume noChampion indlulisele kwabakhulu kubizwa amaphoyisa abantu abahlukumezeke ekhaya abarayishwayo kule clinic siyakhona ukuthi sigcine sibange nabo umthetho bagcine besizakele kuningi nje okwenziwayo kodwa nje intsha iyajabulela ukuza la ekhaya ngoba isabambila yini iyasizakala ngokusheshsha.
Ngifisa sengathi ningakwazi ukukhululeka uma nifike kwama clinics sikhona njengo Groundbreaker sikhona ukuze sinisize. Ngicela nikhululeke nize kwama clinic.
Life is so important. The reason why success tastes so nice, not everybody succeed. Koloi ukakra second hand. Spanera livili litairo ukakra second hand. Okra kai lutu labubit. If usayithokomele, life comes once. And for now, ladies and gentlemen, another entertainment. DJ Lion King. Thank you, Doug. And the Lion Frentage. Dumela. 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 Alekaina. Ireke se molle ke le dumedisa ibile ke tsebele jalo ke la magalafa mo letsatsing la gompieno by me DJ Yellowbone, the one and only Mr. New Private School Most Basing. I'm not alone. It's a majalo Lion King production. Yeah, respect that this young man. Alamushabele matoko. Hopo la korende celebrate 16 June. Ere Sarafina. Home piano. I have a track here. Private school piano. Makaitso. Ere Sarafina mama yo. On Facebook, DJ Yellowbone Radio DJ. Kekorata tata kere. All the way from OMT radio station. Kamote voice ngano sepe. Ere Sarafina. My selector. Sure. Ooh, God. Chase somebody. Sure. Mara. Sure. Cheers, somebody. Hi, biggie, mamela ni sala salela. Uza sambentona ya miskusu chwala bade lame. Sure. Yo. Sarafina mama. Sure. Utagare. Sarafina mama yo. I went. Are chape matojo. Che. Sarafina.
I went now Sarafina. Auzara. I went now Sarafina. Auzara. I went now Yazara Zara. Auzara.
Akona Mazayoni. Rebeta Postola biano. Bagai ma Postol. Che. What's up? Bagai ma Postol. Abatene ba chape matzo. Sure.
Janong tswapele dialogue go dumedi sa ibile ka tswapele dialogue go amogela mo letsatsing la gompieno a this is DJ Yellow
Mr. You promise good most spacey
I kgonaganya le
the impossible kicks
Kharabo kharampa jalo ya mo
Generata tata bafeto Big love
Matanka boss tlhoka Falo re dumetse mmino se se pe jalo make sure gore tswapele dialogue re buka
Sure Gele buhile bafeto Shapa matsogo Hey, to the song. Dumela ngashele kai. Ari, kubale mameleng oke black tea ka sebele. Hare zo 1 2 3 4 4. Yela 1 2 4. Hare. Wa, hekere wa. Are.
Wesandwa sa.
Kubale meleng emela. Wena bambolwa Agirle huka Anya
Yeah, I've been trying my best since Wesandwa sami wena mamela Awunyasifela mamela nyaktanda Awini ngawe Abazali bakhuluma ngezinkomo mina can afford
Kimala bolo bafethi kimala bolo
Let me give you what you want Ipi mali mali ya malolo Zipingo Mongo
Unfortunately, bafethi kumela go tshela
ke rile ke sa ntšha dikgomo ka lešakeng ka bona ngwanenyana wa dikoti marameng ka re hey girl bona o mbetla ka gare ka bona wena ka no thoma le go metša mare ka betha ke fofusa matepe ke ra lerato bjale pelo ya ka e bipetše ka lerato ke go rata ka lerato la baratani ba go ratana ka lerato la go ratega bu ko botša malome ke humane mosadi a ska potša ka motswala mapelo ja serati
eh wona mogabisi wa ditoro tša ke rata wena fela tee ka monwana wonka tamela wa re tla dimolongwa a re ba fetsi a ke re la yitsi sosa of herriwe
ipi mali mali ya malobolo Zibingo.
Thank you girls, thank you girls, thank you.
Zibingo, mongo zosulis.
Arrecha bafethi,
Jobu zale gamnandi iskasok jola zale gamnandi. Jobu zale gamnandi iskasok jola zale gamnandi.
Ikiri chobu zale gamnandi iskasok jola zale gamnandi. Sosa. Kalele boka bafethi.
Iskasok jola zale gamnandi. Astrolega mnandi, iskasok astrolega mnandi.
Kalele boka bafethi ka lebitso ke Thapelo all the way from Black D on social groove kalele boka. Toko. Hey what's it? Oh lolo. Hey wena. Ozala. Hey wena. By the way, just yes kid. On the way from social groove. Give a fun of Mino. Give a fun of Biano. Ebati. Ayebo. Oh lolo. Can you feel it? Can you feel it? Whoa, stop! Ari. Whoa, Camera, social media, Kisnezi's Kitty, follow. The song is out. Que reveal. Angisho guys. Angisho guys. Tako.
I'ma love you like it's protocol, and I promise that I'll never hurt you anymore. Hope you ready, cause I'll never ever let you go. We've been steady, so we never fighting anymore. Oh, I'ma love you like it's protocol, and I promise that I'll never hurt you anymore. Hope you ready, cause I'll never ever let you go. We've been steady, so we never fighting anymore. Oh, I just wanna see you every day. Get my smile automatic when I see you any day. I don't wanna lose you, girl, I'd rather fade. Be erased in your mind like you never knew my name. I don't wanna separate, I just wanna entertain. Would you let me penetrate? We can do it in your way, but I like it slow. More like it's a blow, scared to let you go. Wish you had a clone. I'ma love you like it's protocol, and I promise that I'll never hurt you anymore. Hope you ready, cause I'll never ever let you go. We've been steady, so we never fighting anymore. Oh, I'ma love you like it's protocol, and I promise that I'll never hurt you anymore. Hope you ready, cause I'll never ever let you go. We've been steady, so we never fighting anymore. Oh, I'ma be there when you all alone. I can be your all if you let me be. You can ask the bros, they know I'm a G. Always got your back like it's on repeat. Said you know that's me, steady's a relief. I won't trip till they say it with no T. R.I.P. to me. R.I.P. to me. I'ma love you like it's protocol, and I promise that I'll never hurt you anymore. Hope you ready, cause I'll never ever let you go. We've been steady, so we never fighting anymore. Oh, I'ma love you like it's protocol, and I promise that I'll never hurt you anymore. Hope you ready, cause I'll never ever let you go. We've been steady, so we never fighting anymore. Oh.
Welcome to In the Mask. Le go khole le stage nkela tumele ona o gona bona la re gona Sarafina le sheba tukomra atumela ya atumela Sarafina we bicha le bana ba ba que programa é YouTube? Llego. Ah, shit.
Babylon sala sala salela uza samba ntwana yami sikuzu twala badela me
Ashu Bana baba mbaka emara Piki piki piki
Ale tiene tiene más que en kwarini
Yevo
Abeko ready Ale tiene tiene más que en kwarini
Yevo
Get them to the beko abeko ready Ale tiene tiene
Bana baba mbaka
Get them to
Dale tabele bana baba
Ale tiene tiene más que en kwarini
Yeah
Get them to the beko
Ashu Ashu Ariye ariye Ayewo 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 Aye Ashu 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 Kale barra raza boga e kajeno rito raza Ashu ayewo 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 Oscar Chama Ker ayewo 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 Bovija You feel it Yeah Ashu Let's ukuza mwana mo Yevo Ayewo 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 Yevo Ariye Wow Yeah, let's go jealous sabana mama.
And for now, ladies and gentlemen, smash and bread. Kiss mesh. Mesh and bread. And Josiah still in the house. Woo. Mesh and bread. Ripila waya waya.
Hey, Master KG.
Wena ubona injabulo abazokuhle kephi khona indaba ndaba isenhlizweni wena ubona injabulo abazokuhle kephi khona indaba ndaba isenhlizweni Nhliziyo yami balisa njalo Nhliziyo yami khala njalo Nhliziyo yami balisa njalo Nhliziyo yami khala njalo Nhliziyo yami Nhliziyo yami Nhliziyo yami Nhliziyo yami Wena ubona injabulo babazokuhle kephi khona indaba ndaba isenhlizweni
saselatan thola phalafala enegijabile kathulufe thulufelo wakubonde ubotebera awkhulude
Izinto zami zambanga online. Izinto zami ay zambanga online. Izinto zami ay zambanga online. Izinto zami zihambanga online. Zima ngomumo online. 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 Zihambanga online. Online. Online, online, zihambang online. Bangibiza ngokudali angishaya impama thintindod yami sekuba namfana usebenzi wami ngiyawuthanda zihambang online. Bangibiza ngokudali angishaya impama thintindod yami sekuba namfana usebenzi wami ngiyawuthanda zihambang online. Izinto zihambang online. Zihambang online. Zihambang online. Zimengumu zihambang online, zihambang online, zihambang online, Bangoket sending attendance, like the phoning check his span, Jella bazali ngabafrostan, angena kui app check it balance, ngiyothenga my food is nice, checking the price. Izinto zihambang online, zihambang online, Bangoket sending attendance, like the phoning check his span, Jella bazali ngabafrostan, angena kui app check it balance, ngiyothenga my food is nice, checking the price. Izinto zihambang online, zihambang online. Pangipisa ngokudali angishaya impama thintindod yami sekuba namfana umsebenzi wami ngiyawuthanda mfana zihambang online. Izinto online, ay online, ay online, kushu hayibo. Bangibiza ngokudali angishaya impama thintindod yami sekuba namfana umsebenzi wami ngiyawuthanda zihambang online. Bangibiza ngokudali angishaya impama thintindod yami sekuba namfana umsebenzi wami ngiyawuthanda zihambang online. Izinto zihambang online, zihambang online, zihambang online, zimengumu zihambang online, zihambang online, zihambang online, zimengumu.
sebenzi wethu usukekela uyikekele malakost akelelwe nanyakubona sebenzi wethu usuthathela sebenzi wethu usukhulumela umasimoshela sebenzi wethu usukhulumela sebenzi wethu usuthathela sebenzi wethu usukekela uyikekele malakost akelelwe nanyakubona sebenzi wethu usukhulumela sebenzi wethu usukhulumela
angishayi angidakiwe didakiwe mandidakiwe didakiwe angidakiwe didakiwe angidakiwe didakiwe izumamami azonibona mandinje izubabami azonilanda angangishayi angidakiwe didakiwe mandidakiwe didakiwe angidakiwe didakiwe endidakiwe wawawe mamami babami kakwami angidakiwe didakiwe mamami wawawe babami kakwami endidakiwe didakiwe wawawe wawawe aya 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 kangipuja funa kunyenza nijana 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 wawawe wawawe mamami babami kakwami angidakiwe didakiwe mamami wawawe babami kakwami angidakiwe didakiwe wawawe 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 wawawe
Daddy, 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 daddy. Banana Morocco. I want the banana Morocco. I need a banana Morocco. I banana Morocco. I need a banana Morocco. Daddy, daddy. Mi cocote, mi cocotelo, mi cocote. Mi cocotelo, mi cocote, mi cocotelo, mi cocote, mi cocote. I never banana mabo, mi cocote. When I love the cream, I bet you so in your bed. Onga funga ngisa mnyango na piano saba cocote. Onga funga senze namba kushilinga piano like totope. Ay banana mabo, banana mabo. 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 Ay wako mama, ese kungenus konondo. Nkete nabantwana about 3 ice cream mngane kudliwe hordons. Masifike kamerini labantwana zone trip bangishaya ngelap dance. I just want the money. You won't give me money. I make open on. Kuhlanyisa ingane. Ufuna ukuyeza imbali. Uphuma to money. Siyospend imali. I-10K ingane. Banana
maboko ningapakoteli. Banani maboko unganitolobeli. Banani maboko ningapakoteli. Banani maboko unganitolobeli.
Nikokote, adere banani maboko nikokote. Wenza ndo bambi kemo ngabeji sinyonyope. Ungafunga ngesemlango ngepiano sabakokote. Ungafunga sinzi namba kushilinde piano la itotope. Ay, banani maboko. Banani maboko. 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 Ay.
Banani maboko bani yeso banyanya bela. Banani maboko piano shalka kotela. Banani maboko bani yeso banyanya bela. Banani maboko piano shalka kotela.
Jepa, ajep, 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 jepa, ajep.
Manuel,